All right, good morning, guys. So today we have Bree Tyger, and she is from the Springfield Greene County Health Department, and she's going to be speaking with us about the Family Connects program. And then John Mooney, there he is, over there. He's going to be talking to us about their Hey Man, You Good campaign. Both of them are really important. I actually learned about them in the Leadership Academy. So please welcome them and be good listeners.
Thank you. Good morning. I am a nurse with the health department, and I'm here to talk to you about the program called Family Connects. I know we have some people joining online, but in the room, how many of you have heard of or familiar with Family Connects? Okay, so we have a few and a few that haven't. All right. Well, Family Connects is a program that started in Durham. I think I skipped that slide. Oh, I'll go over. It started in Durham, North Carolina at Duke, and it was then called Durham Connects. And they did a randomized control trial over a 10-year period of time with around like 10,000 families in that time period to try to see results from this study. And that is really where they birthed Family Connects. So since that time, now we have Family Connects International. This program is in several states statewide, but we are the first site in Missouri that we are doing this program. And the goal, I'm going to kind of go backwards, sorry. The goal is to strengthen connections for families with newborns and link them directly to supportive community care services resources. And then the vision is equitable outcomes for every newborn and really every mom and family here in Greene County. So this is a program that we are offering only in Greene County. And this is kind of what it looks like. This is the slide that shows you that. So the program is offered at the bedside at Cox and Mercy hospitals currently. We've been going at the bedside for almost a month. At Mercy, we've been a little bit less than a month, but at Cox, we've been just over a month. So we go to the bedside while the families are still in the hospital after they've had their babies, and we introduce them to the program. And then if they're interested in a visit, we schedule that visit around 3 weeks postpartum. The reason for that is because most women that have babies, they go home from the hospital and then they don't have a visit until 6 weeks postpartum. And so the goal would be to really bridge that gap in that time period and to provide support in that period of time when we're seeing some poor outcomes for moms and infants. So we can kind of screen for postpartum depression, we screen for preeclampsia. All of the visitors are nurses that do these visits, so they can really do that medical assessment in the home. And then they do an assessment for the infant as well. So we do a head to toe assessment of the infant. We can check on feeding and provide support for issues like breastfeeding. We can check on just bottle feeding. We can provide support and education on a lot of topics that we'll go over in a minute. But that's kind of the goal of that visit. And that's why we do it in that time period. So we can do them up to 12 weeks postpartum, but ideally it's happening before that 6 week postpartum visit. And again, it's available for all families with newborns in Greene County. Our nurses typically have 6 to 8 new cases per week. That's kind of the caseload that our goal would be when we reach capacity. And then after we have the visit, we want to make sure that those referrals that we make in that visit are effective and actually did happen. So I don't know how familiar you are with making referrals in our community, but there's a lot of ways to make referrals and receive those referrals. And there's a lot that can go wrong in that time period when you make that referral. So we want to make sure that that's actually happening and is effective for those families. So we follow up at 4 weeks after the visit just to make sure that everything went okay and that that was a helpful resource and nothing else has come up since that time period. And then just nurses are trained. So we have training from Family Connects International, and then our nurses went through additional training for lactation support so that they can provide that in-home lactation support for those moms. And so you might think, like, why a nurse? Because we have a lot of home visiting programs here in our area. Why is this different? Really, the way that it's different is that it is that nurse that's coming in the home in that critical time period to provide those eyes in the home, but also those connections to community resources. And I am proud to say that nurses are one of the most trusted professions. That kind of was increased through COVID, through all the things that we were able to do in that time period. And so being in someone's home is a very vulnerable thing, right? Like to invite someone into your home is very vulnerable. So having someone that you can trust, that you know is really there for your benefit, is really why it's a nurse in this program. And then that medical knowledge that they have. All of our nurses have backgrounds in postpartum, labor and delivery, or NICU, so we can kind of lend that perspective in our visits as well. And this is just emphasizing that this is a universal program, and it's really important that it is universal. We have had programs in the past that have been for high risk families, which have a place and are very important. But there is stigma that's created when we say this program is for you, but it is not for you. And it's for you because of this. Like, I think that people hear there's something wrong with me, right? I need more support, but they're fine. So to hear that we could all use support is something that is empowering for families, and it's something that they do in other countries, but we haven't done a very good job of here. And it is difficult to bring a baby home from the hospital. It's difficult to have a baby. And so to provide that support in that time period for all families and to kind of just empower them that it's okay to need support. It's okay if you have financial resources. It's okay if you have education. You don't have to not have these things to need some support in that time period. So we provide that support universally for all families in Greene County. And that's part of the Family Connects model. So this is part of the randomized control trial. Like I said, over 10,000 families. They collected that data over that 10-year period of time. And these are some of the things that they saw in that control trial. So 95% of families had at least one risk or need that was identified in the visit that the nurse was able to meet. 1 in 5 had not scheduled a 6-week postpartum visit. And I always think with this slide, that is not great, but think about also how many didn't go to their visits. So they had it scheduled, but they didn't go. Well, these didn't even have a visit scheduled. So that percentage would be much lower than for those families that would go to a visit, obviously. And then 1 in 3 birthing parents had mild or significant depression. We do screenings in the home. It's called an Edinburgh, and they were found to have mild or significant depression, and we're able to connect them to resources through that time period. And then 55% didn't have a regular medical care provider. So then they could connect them to that primary care provider to provide support for them. With Family Connects, because it's an evidence based program, there is specific information that we go over. I won't bore you with it. It is interesting, but it's just a lot. So there's 12 domains. We won't go over all of the domains, but this kind of breaks it down a little bit for you just to show what exactly we're doing in the home. So it's broken down into the 4 categories of healthcare, infant care, safe home, and then parents. So with healthcare, we're making sure that they have an OB provider that they know to follow up with. They have that 6-week postpartum visit scheduled. They know when to call. For the infant, they know when to call the pediatrician. I've been doing home visiting for several years. I've been a nurse for a long time, and just I've seen both ends. Like, I've seen families that are like, "Oh, my baby is fine. They haven't gained any weight. They haven't eaten in 12 hours, but they're fine," And then I've seen the other end where it's like, "Oh, they haven't had a dirty diaper in an hour, and I'm a little worried." We have both extremes. And so to kind of give them that perspective, like, "Hey, you're doing fine. Everything is fine with your baby," or, "Hey, this might be concerning. You need to call your pediatrician. This is something that needs to be done." We can kind of give them that perspective there. Then we can connect them to healthcare also through insurance. So if they don't have insurance for some reason, maybe they didn't enroll in Medicaid, that can be complicated coming home from the hospital. We can help them navigate that process to get enrolled in insurance for their baby and make sure they still have coverage. For the infant care, we talk about the period of purple crying. I don't know if you've heard of that curriculum, but basically the goal is to prevent shaken baby syndrome or abusive head trauma for infants. And it's providing families tools with how to cope with that period of crying because all babies cry and it is normal. And I don't think we all hear that. So, kind of just giving them that tool of like, hey, this is normal. Your baby will cry. This is how you deal with it. It's okay if it stresses you out, but what do you do when you get stressed out? Let's talk about some tools there for you. We go over a safe home, and then we talk about the parents' well being a lot in that visit as well. And then we kind of cater this visit to whatever that family needs. So we don't talk about every single thing and, take 2 hours for our visit. We can really focus on what that family needs. And then we have resources that we provide for them on our website. So if any of you are interested, you're welcome to go to our website as well. We went through evidence based resources and websites, and we put that all in one place so that they could reference that. So if they have questions, they're not Googling those questions and finding, like the Reddit post about it. Like they're actually going to an evidence based resource for that information. So we leave that resource with them after the visit too. This is just some more interesting information from the randomized control trial. So at 6 months, they did interviews after the visit, and they found even at 6 months after they had that one visit, because typically we're doing one visit for this program. We can do up to 3, but typically families will receive one visit. So even after that one visit, They had more connections to resources at 6 months. They reported more positive parenting behaviors. They had higher quality parenting behaviors, safer home environments, higher quality childcare for when they're going back to work, and then they had lower self reported anxiety. This shows more outcomes that is pretty interesting. So, this is at 12 months and 24 months after the visit, and it shows a reduction in emergency room use. So, at 12 months, they had a 50% reduction in emergency room use. And then at 24 months, they still had a 37% reduction in emergency room use. And then this shows Child Protective Services investigations. This is at 60 months. So you're looking at 5 years, a 5 year period of time after this visit that we did in this postpartum period of time. And they showed a reduction of 39% in that period of time, which is significant. And I know you're all probably very familiar with how many cases we have of child abuse and neglect in Greene County, and it is significant. And so, if we could have a 39% reduction in those cases in Greene County, what would that look like? That would be incredible. So, I would love to see that, and I hope that we do see that in 5 years. Here's our website. It's familyconnects417.com. You're welcome to check it out. We have some flyers that I think that have been posted here in the building as well. And I'm happy to provide any handouts for any of you if that would be helpful with what you're doing. But please check out our website. And then I have just some introductions of our staff. So Ruth Brown is our Family Connects coordinator. I'm our community alignment specialist. We have Jill Allen. She's a nurse lead, so she does part-time visits, and then she kind of leads the team of nurses. Alexis Johnson is our program support specialist. So her background is as our community health advocate. So she's the one that kind of helps with those Medicaid issues that come up. She can provide resources more extensively than what we can provide in the visit sometimes for those families that need more help. And then we have Elisa, Angela, Tony, and then we haven't put her picture up yet, but we just hired a nurse named Joanna who speaks Spanish, and we're so excited to have her on board. So she'll start doing home visits hopefully soon. She's been with us for a few weeks now. And then I have my contact information in this slide. So I don't know if you'll be sharing the slides, but you are welcome to reach out to me if you have questions, if you would like some information, if you would like some flyers or handouts, I'm happy to provide those as well. But thank you for your time. Yeah.
Good morning, everybody. Sorry, I don't have a sweet slide deck, so you're just gonna, unfortunately, if you're online, you'll just have this one slide, and then people here, you have to look at my face. So sorry about that. What Hey Man You Good is, it's an effort that's been created to help increase the number of conversations around mental health, specifically focused on men. So this is created by the Healthy Living Alliance with funding from the Community Foundation of the Ozarks. And if you're unaware, mental health is an issue that is kind of a big deal across the entire country, and we are no exception to that. We've been working on mental health for almost a decade now in a community setting outside of just organizations that are providing care, but trying to do a better job as a community with recognizing mental health, the how common it is, and what an impact it can have in our lives. And specifically, this program focuses on men because unfortunately, the suicide rate in our community is higher than it is in Missouri, and it's higher than it is in the nation by a pretty wide margin. And so, what we're trying to do is have these conversations to help address the suicidality of our community. And unfortunately, men, it happens far more often than it does in women, making up about 75% of all the deaths due to suicide. So certainly an important issue for us to be able to talk about. And as a man, and I'm going to guess everyone in the room has a man in their life in some form or fashion, we're not always great about talking about what's going on inside. A lot of times we hold it in. We let that stress get to us. We don't talk about what's going on because unfortunately it's been stigmatized for a long time that men don't talk about their feelings. But what that does is it really just bottles it up and we don't seek help. And so that's what Hey Man You Good is really trying to get at the heart of, is trying to encourage men to have more conversations about their mental health. And so we do this through a couple of different ways. So there's a whole communication campaign going on. So you might have seen the advertisements on social media or television that are focused on the campaign. Again, is just trying to help people recognize how common struggles that we all have, um, how many times are connected to mental health, and how easy it can be, and how important it can be to just have that conversation. So we're trying to get more messaging out there, but we're also trying to do more conversations like this, or more talks like this, and more partnerships with businesses and organizations and different groups to just help normalize the conversation of mental health within those groups. So that's one of my asks here is whether it's your department or your another group that you're associated with. If you'd like to have more conversations around mental health, please feel free to reach out to us. Cammie's got our contact information. We're happy to partner on that. Um, but the other things that we're really trying to do is connect people to resources in the community. So we have a wide network of healthcare providers that can help treat mental illness. We also have a lot of things upstream from that. So not everybody that has a mental health struggle or challenge necessarily needs treatment. And there's a lot of other things that we can do before we need treatment that will help. So some of that is just self-care stuff, how to reduce your stress, how to have some conversations, how to manage that stress yourself, and help other people in your life manage that stress and the mental health challenges that we all face. Some of the other things is to connect people to trainings. So has anybody heard of mental health first aid, or anybody been through mental health first aid? Okay, that's a wonderful training. It takes a little bit of time, but it's been a wonderful training. So it's something I went through maybe 4 or 5 years ago and have been able to use it many times. And until I went through that, it was a tough conversation for me to be able to have when I knew someone was struggling with their mental health. And unfortunately, I've had to have the conversation a couple times with people about suicide, and they're thinking about suicide. And before that, I would kind of look in my toolbox, my tool belt of conversation starters and how to have that, and I had nothing there. And so being able to go through that gave me some of the tools to be able to have that conversation and help that person get help. So that's part of what this is focused on too, is helping connect people to those other resources. The website that kind of houses everything, you're going to notice a theme here. So this is mentalhealth417.com, very similar to Family Connects 417.com. So we're just trying to help connect people to that website. So on that website, you can get yourself checked out. So there's a lot of assessments that you can go and just kind of do the self check-in on how your own mental health is doing. There's information on a lot of different conditions on mental health, so you can learn more about those conditions. It talks about that self-care and the things that we can do to help take care of ourselves and help keep that mental health and mental challenges and mental stress down. So we don't need treatment, but then the last thing it does have is local treatment resources. So it kind of becomes this one-stop shop for people here within the community to be able to go to different resources. So that's kind of it in a nutshell. What we're really wanting for people to take away from this whole effort, though, is the willingness to have a conversation. If you know people in your life or you yourself are struggling with something, it's okay to have the conversation. Being someone that's gone through depression a couple years ago, being able to have that conversation and acknowledge that, I found a whole lot of strength and a whole lot of healing in having those conversations. So that's really the big takeaway from this. And we hope that you're more likely to have that self check-in or to check in with somebody else and just have that conversation, because that one conversation can make a huge difference. So we also have information. There's a few things here that if you just want reminders on what Hey Man You Good is, or to be able to connect in a deeper level, happy to come back and have some of those conversations or help connect you with resources. And I'm happy to take any questions that you might have. Yeah. Yeah, mentalhealth417.com. Yep. Okay. Well, thank you guys for your time.